Hello, everyone, and thank you again for joining us for another Facebook Live update about COVID-19 right here in Berrien County. Today, we are joined by Nicki Britten, who is the health officer for the Berrien County Health Department, as well as Dr. Loren Hamel, President and CEO of Spectrum Health Lakeland. Thank you both for being here. You may note that Dr. Hamel, we are unable to see him today. We've had some technical difficulties, but we will be able to hear his update as he's able to provide it with audio. So just to get us started again today, let's take a look at where we sit with some of the trends we've noted in the past week. It looks like maybe we've seen a decline in the numbers of cases. Nicki, tell us more about that.
Yeah, I will actually share a graphic with everyone here. So you can see on this slide here, we're showing the number of cases across the whole pandemic going back to March. And you can see the steep increase in the cases here that we've been experiencing really since the beginning of October. Right around Thanksgiving, there started to be a little bit of a leveling off and a little bit of a decrease here. And some of this continues to be a little bit difficult to fully understand and put in the right context. And there are many things that are changing in our testing environment. And we know that as testing changes, the ability to detect and come up with confirmed cases does change. There have been some organizations like Spectrum Health Lakeland that have moved towards testing only symptomatic people. So that has reduced some of the people who are eligible for tests. And we also just know that the number of tests did decrease after Thanksgiving, right around that Thanksgiving weekend, and has continued to be lower by a few hundred tests a day than it was just before Thanksgiving. So in light of there being less testing, we are seeing fewer cases. We know that testing wasn't driving the increase, so it's really hard to say. I know people want to know exactly what's going on in this minute. Sometimes with public health data, we need a little bit more time to fully understand the context. Bottom line, though, is we're sitting at we have about an average of about 120 new cases of COVID per day. And while that is a lot lower than we were projecting before Thanksgiving, because the trend has leveled off a bit, thankfully, that's still 10 times higher than what we were seeing at the end of September. So we're still at very elevated levels, but I'm encouraged by what we're seeing in the trends. And I know, Dr. Hamel, you're going to speak to this a little bit more too, but we have seen similar leveling off or at least slowing of growth in the number of people in the hospital. And that is encouraging as well. Definitely not the ideal scenario, but it seems like we're not growing as rapidly as we feared we would be in these first couple of weeks of December.
Well, that certainly does sound encouraging. Can you give us an update about how contact tracing is going? Do we know where most of the cases are coming from?
Yeah, so at the volume of cases we have, it's still difficult. We're not able to do the case investigation and contact tracing to the extent that we were really through October. With the number of cases, that's unmanageable to be able to make all of those phone calls and notifications and all of that. So we are doing what we can. We've continued to prioritize certain cases and contacts that are in higher risk groups or maybe work in higher risk settings to make sure that all of those exposures are known and quarantines are done. But we are still very much depending on individuals to understand that when they've been exposed to somebody with COVID-19, that they do need to quarantine. And it is a 10-day quarantine. As we talked about some of those changes last week, there's this 10-day option for reducing quarantine. There are still some situations, especially for people that enter high-risk settings, where a 14-day quarantine will still be warranted, and our staff will help guide you on that. But for the average person, it's a 10-day quarantine now.
Excellent. Moving to you, Dr. Hamel, and just as a reminder to our friends here on Facebook, Dr. Loren Hamel from Spectrum Health Lakeland is here with us. You just can't see him on your video right now, but you should be able to hear him. Dr. Hamel, there's been a lot of focus on hospital capacity recently. We know we've heard that nationally. What kinds of numbers are we seeing here locally at Lakeland?
Oh, thanks so much, Jillian. So we are officially kind of listed as at capacity. That's kind of a relative term because that means our regular beds are full. we've done a lot to expand our capacity to be able to accommodate both the folks that have COVID and the folks that have medical needs that don't have COVID. And of course, we're doing our very best to keep those folks isolated. Our 7-day average has gone from, the 60-ish range to the 70-ish or mid 70s over the month of November. We're seeing day-to-day variation that is pretty significant. We've been as low as 56 patients. Today, we have 70 patients on the inpatient side. We can accommodate 60, 70 patients. We're concerned as we project the future still. We're concerned that that could grow. We have modified our projections. We had a worst case scenario up close to 120, then revised down to about 105, now revised down to the 90s. And I think that's thanks entirely to what Nicki was referring to in kind of the county level data, and that it appears that people are doing their best to be careful. And that is paying off. It's helping prevent just an intolerable surge. But we're full, hanging on, caring for both COVID and non-COVID. And we can do that. We can do this for several more weeks as long as things don't grow dramatically.
Well, we are all certainly interested in making sure we're doing our part to keep you guys operating at your optimal capacity. So speaking of hanging on for a few more weeks, Nicki, earlier this week, we did see MDHHS extended the epidemic orders that were in place through December 20th now. So do you think that the extension in these orders, is that going to help us see our numbers start going in the right direction? Oop, you're on mute.
Sorry. It very well could. It's always hard to really, especially in a moment, to attribute what is the cause of changes in disease levels in the population. But we do know that we're seeing at least a slowing down of the increasing number of cases that we've had. And that is something that, again, is very good news. It just means we haven't fallen off the edge of that cliff that we predicted. It means we've stopped just short of that. So there's still a lot more work. There's still reason to remain very vigilant. MDHHS had expressed that a big reason for the extension of those orders was to have a little bit more time to understand really what's going on. What we're seeing in the data with a decrease in the amount of testing that's happening is a phenomenon that is being seen across the state, where there's just lower levels of testing. When we have lower levels of testing, we have less information about what is really happening in terms of community transmission, especially, as I mentioned earlier, as many testers across the state are changing their criteria for who can be tested. That makes it harder to know what's going on. So MDHHS did want a little bit more time to be able to see what has been the impact of our interventions over the last few weeks, but not so long that it stretched on for a long period of time, and to give people a little bit of time to respond with whatever comes next before the Christmas holiday.
Dr. Hamel, turning back over to you, we recently learned about a new outpatient therapy that is available now for treating some of those mild to moderate COVID cases. Can you tell us more about that?
Yeah, that's monoclonal antibodies. We've referenced that in our live streaming conversation previously. It's available. As you stated, it's for outpatient use, so one-time infusion. It's designed to give to folks that are higher risk of COVID complications and a higher likelihood of needing a hospitalization or ICU. And we hope that's going to be beneficial. So it is available. We are set up to do that. And we'll be certainly watching the results of that. Those, of course, we're collecting data around the country, but it appears it's going to be a useful treatment.
That sounds really promising. And it's great to know that it's available here locally too. So there are a lot of folks that are wondering how they can give back this holiday season and contribute to some of the fight against COVID-19. We know that there have been many individuals in our community who have had COVID and successfully fought off the virus. We know also that there has been a need for donating plasma. Is this still something that we need here locally, and how could people go about doing that?
So let me answer your broad question first, giving back, and then specifically around the plasma. The first thing is just recognize, despite all the conversation around COVID and all the data that we've seen, our county has only 1 out of 20 that has experienced a diagnosis of COVID. So, the first thing to do to give back is do your best not to get sick. Do your best to keep those around you from getting sick. That means we're not going to run out of supplies. We're not going to run out of plasma. So number one, that's a good way to give back, is just be careful. The convalescent plasma donations are down, and that often occurs in holiday seasons. People think of doing other things than giving blood, but it is not just the convalescent plasma that's critically important. It's also all the blood products are critically important to saving lives in healthcare. And our blood donor Versity, our blood bank Versity, has noticed a decrease in blood donations across the state, not just in our region, to where the donations are not keeping up with the demands. And we've had to reach outside of the state to help take care of some of those needs within the state. So we just encourage anybody, if you're a blood donor, give blood. If you've had COVID and have recovered, give convalescent plasma. That absolutely can help save the lives of your friends and neighbors.
Excellent. So let's dig into another topic that I know is on a lot of people's minds. We've heard so much in the news this week about a COVID vaccine. There's a lot of exciting things on the forefront. So Nicki, let's start with you. What's the latest news on the COVID vaccine? What do we know right now?
So yesterday, there was a day-long meeting of an FDA advisory committee making recommendations to the FDA about emergency use authorization of the Pfizer vaccine. And so the Pfizer vaccine, this is the first one that has requested this emergency use authorization. There's another manufacturer of vaccine from Moderna that will go through the same process next week, or is scheduled to. But so this is the first vaccine that is being presented before the FDA to be granted this emergency use authorization. The FDA advisory committee did make that recommendation. The majority made that recommendation. There were some votes against that recommendation, and those votes were primarily about concern about 16 and 17-year-olds and wanting to see more data around 16 and 17-year-olds before it would be approved for those age groups. So right now, today we're expecting the FDA to consider that recommendation and either provide the emergency use authorization or not. That's a decision that they're making. And then when that authorization is granted, if and when that happens, then the ACIP, and forgive me, I always get that wrong, it's the Advisory Council on Immunization Practices, I believe. That is the group that will then finalize the recommendations of the priority groups of who gets the vaccine first and how that gets doled out. Now, there have been a lot of things in the media about predictions about what that final recommendation would be, and based on what the ACIP has already put out there. The headline really is that the first people who will have access to the vaccine, it will be healthcare workers and residents of long-term care facilities like nursing homes. So those are the groups that are in that first priority group. We expect as that becomes finalized, and that's what a lot of the planning has been around. So that's where we stand. If the emergency use authorization is granted today, it could be as early as next week, middle of next week, that certain healthcare providers across our country will be vaccinated. And there's a whole, there's priority grouping and phases and tiers all the way down, multiple levels of doing priority, because the vaccine will be in limited supply. The first allocation to the state of Michigan is only 84,000 doses. And we have a lot more people that are in that first group than that. But weekly, there will be more allocations continuing to come to the state. The Moderna vaccine will, in theory, if everything goes right, could come online a week later. And so vaccine will start coming into our community. As that's happening, though, it's important for the public to recognize there are projections based on manufacturing and how all of this will roll out. It could take us through the end of February to get through that first priority group of the healthcare workers and long-term care facilities. So if you're somebody who's out there, a first responder or some other critical infrastructure worker who would be in that second priority group 1B, it may not be March until you would be eligible for getting a vaccine. So while it's very exciting that we have a vaccine that's on the brink of being approved and used in this country, and all of the things that immunity to this virus will bring to us, that is very exciting and hopeful. It's going to take months for this to roll out. It's very complex to distribute this across the population. I'll pause there and see, Loren, what you'll add to that.
Yeah, very nice summary. Just a couple things. We at Spectrum Health expected, based on conversations several weeks ago, to get 30,000 doses. Then we were told, no, that really is going to be, 995 doses. The most recent estimate is somewhere around 4,500 doses, which is not the 30,000, but way better than less than 1,000. At least that's a good start on immunizing some of the most vulnerable. Obviously, with that commitment comes sending vaccine enough 3 weeks later to re-immunize those folks that just got vaccinated. And so, that's part of the complexity of this, is how many folks need that second dose versus how many folks are still waiting in line for their first dose. And all of that will get sorted out. The data is becoming available on side effects, and it is, I would say, mostly encouraging. When I say mostly encouraging, the risk of serious side effects appears to be extremely low, and that's always good. On the other hand, it probably is a little bit, for some people, a little bit more than getting a flu shot, in that the frequency of body aches and headache and chills, some of those things where you feel a little bit flu-like, is a little higher likelihood of that occurring, but essentially everybody is getting better in a day after that dose. So I don't think it's alarming. I think it's just, be aware that you don't necessarily want to plan to go to work and be there all day long when you get your vaccine. No, you might need to have your vaccine and go home and take a Tylenol and crawl into bed. A few may do that, but I think the data is mostly encouraging. I'm certainly going to take it when it's available for me. When you compare the side effects of the vaccine, I can tell you, for those that have had serious case of COVID, it is much better to get a vaccine than it is to take your risk with the disease. That sort of would be my medical recommendation.
Yeah, and if I could just add to that, when talking about some of the side effects of vaccination, when you're talking about, fever and body aches and some of that stuff that we associate with influenza or flu-like illness, a lot of times those symptoms and that discomfort we feel is actually a result of our immune system working.
Exactly.
It's a result of our immune system fighting that virus or responding very robustly to the vaccine we've received. So that's why these types of side effects are commonly seen with vaccines. It's actually evidence that your immune system is working. Now, just because you don't experience any of those side effects doesn't mean that it didn't work for you and you didn't have a robust immune response. Everybody's different and there's different factors. But it's not that the vaccine is making you sick, but your body is responding in a way that you do when you're sick because you're having that immune response. And we're hearing that there's some data out there showing that maybe about 15% of people are experiencing some of those mild side effects that might make them want to go home and take that Tylenol and just feel a little unwell. And usually within 24 hours, that is resolved. It's not everybody who gets that vaccine. It is a smaller proportion, but definitely something that we're incorporating into our planning. I know Lakeland is as well, for just in terms of healthcare workers, making sure not all of our healthcare workers may or have the chance of experiencing those side effects at the exact same time. And so planning the logistics of that rollout is really important.
Very well said. It's an indication it's working, not that you're getting sick.
Right. That is good to note. One question that we've had come up a few times is, if somebody knows that they had COVID, that was confirmed and that they were able to successfully fight off the virus, when the time comes, do they still need to get the vaccine too?
Experts say yes, because we're not certain on the duration of the antibody response from the disease. And there's a lot of folks that have had the disease and later find out they didn't keep an antibody. So the expert recommendation is when it comes time your turn, you should take it too.
Yes.
Good to know. So knowing that this will be a many month-long process that is very highly detailed in its logistics and planning efforts, people may need to wait a little while longer before they can count on getting that vaccine. Nicki, what would you say to folks in the meantime, especially with the holidays coming up?
So, I mean, it's important to keep in mind, we are still seeing high levels of COVID-19 transmission in our community right now. We are encouraged that, like I said before, we haven't really fallen off this cliff where things have gotten really, really dicey and out of hand and beyond the capacity of our healthcare system. I am very grateful that that has not happened because we were on a trajectory for this to be a particularly ugly week. And it has slowed down. So grateful for that, but we're still standing there at the edge of the cliff looking down. There's potential that that could still keep going if transmission continues. With a lot of the things that are typically associated with an average holiday season, with a lot of traveling and mixing with households and seeing the people you love and care about in person and exchanging warm welcomes and all of those sorts of things, that does pose a risk for really altering our trajectory again and setting us up on that sharp incline again. So I'm going to sound like a broken record here, but we're really, really encouraging everybody to stay diligent with your preventive practices of really minimizing the people that you have close contact with, washing your hands, wearing your mask, maintaining social distance whenever you're around people outside of your household. And similar to with Thanksgiving, really be thinking about your holidays and how can you scale back and how can you think innovatively about how to spend this time and show your love for others during this time with maybe not occupying the same physical space. So that's going to be really important. And then heading into the new year, I think it's important for all of us to go into 2021 eyes wide open. Having this vaccine coming out right on the brink of a new year feels really exciting, but I expect the first 6 months of the year, it's going to be a bit messy. We're going to have some people who are vaccinated, but definitely not the vast majority of our population. That's going to take time over months. We'll get there. We're still going to probably have heightened levels of transmission. We're going to continue to have some of this weariness of when is this going to end? And there's going to be a time where you might be vaccinated and you're still going to have to wear a mask and you're still going to have to watch your social distance because that's what we need to be doing collectively. And I just want us all to be prepared for that for the first 6 months of the year. And then we can reassess where we're at after that.
Absolutely. Dr. Hamel, anything to add as a closing thought?
No, I just want to thank everybody for their diligence. Your diligence shows. We're seeing it, I think, in some of the early response in the numbers. I appreciate that so much. That helps keep your friends and neighbors safe. We wish you all a COVID-free holiday season.
Yes, and thank you, Dr. Hamel. Thank you, Nicki, and thank you for joining us today for this COVID-19 update for Berrien County. Just as a reminder, there's lots more information on the Berrien County Health Department website, as well as Spectrum Health Lakeland. You can always visit those sites for more information. Thank you both for participating, and thank you for watching.
Thank you.